So Matt, based on your experience, can you rank which of these tools will create the most significant impact for practices in the near future?
Well, it's important to know that every practice is unique, and every practice has an existing set of tools, an existing set of processes that they use. But we have seen two specific technologies that do have a dramatic impact across the majority of practices that we deal with. The first is an inventory cabinet. As we've said, practices spend a large amount of their financial capital on their drug spend. So having an inventory cabinet in place that really gives you a comprehensive set of tools around managing your inventory in your practice is essential and has really been beneficial to the practices where we've seen that implemented. The other is a reporting or an analytics tool that enables the practice to look across their entire business process to see where they may have levers that can be pulled for improving financial performance, where they may have gaps perhaps in the payment times from payers, where they may have missed charges. That's a big one that we see, that practices just administer drugs and then somehow it doesn't make it back into the practice management system and doesn't get paid by the payer because you never submitted the claim. So having a tool that really uncovers those inefficiencies in the practice has been kind of uniformly accepted and has had great results that we've seen, where we've seen practices implement those.
Payers have been cautious and deliberate about engaging in initiatives like you have described. Where does their hesitancy lie, and how can it be overcome?
Well, cancer is a complex disease to treat, and there are a lot of treatment options. There are a lot of variability in how to apply those treatment options in the care plan that providers choose based on the stage of the disease and other clinical factors. So I just think payers have been hesitant to insert themselves into that. Providers traditionally have been resistant to having third parties such as payers really insert themselves into the care planning and into the treatment pathways and the protocols and the regimens that are used to treat cancer. So I think that that's the reason why payers have been reluctant to be involved in that. We are now seeing an opportunity for that to change. I think as physicians are more interested and now have the tools in their practice to better manage and report on their treatment regimens, to have data that support adherence to certain treatment regimens, and can really start to predict or to demonstrate predictability in the care plans, there is an opportunity to take that to the payers now and to open dialogue about how to create quality programs or create initiatives that really demonstrate not only value for the payers but also for the physicians. And we're now starting to engage with physician practices in our membership and with payers to discuss opportunities to see if there's a middle ground where we can apply best demonstrated clinical practices and demonstrate the impact of those clinical practices, not only on the quality of care, but also on the cost efficiency that can be generated from that. We think there's opportunity for physicians and payers to collaborate on that.
What a great way to really create a bridge between the need for more cost efficiency, which we all know payers are looking for, but also to improve clinical effectiveness, which obviously are what physicians want and ultimately what our patients need. So there could be a really good ending to this whole discussion, although it's been a long time in coming. Yes. Obviously, there is broad manufacturer interest in knowing how, when, and why their products are used in the care setting. How do practices feel about sharing de-identified clinical data, and do you see attitudes toward this changing significantly in the near future? Well,
security and privacy of patient clinical data is certainly, at the forefront and in the minds of physician practices. You're right, historically there's been some hesitancy to share that information and to make that information available, even in a de-identified format. I think two things. The technology of really has enabled us to guarantee the security and the privacy of the data that might be shared from the physician practice. There's a lot of rules and regulations obviously in place that not only physician practices but any of their business partners have to comply to. So we're really now in a position where the comfort level for sharing that information has made physicians more open and willing to share that. I think especially when the physician sees that the data is being used to demonstrate the clinical appropriateness, the clinical effectiveness of the products and the therapies, they're much more willing to open that up and to have that be available.
Do you feel we're moving toward greater overall transparency of data throughout the oncology industry? And what effect do you think that would have on the way care is delivered?
I think we are moving towards greater transparency. I think within the practice specifically, we're moving towards greater transparency across systems and across the processes within the practice. As we've talked about, systems historically maybe have been compartmentalized. The data has not flown necessarily, consistently through those systems. So we're getting to a level of technology sophistication where there's transparency even across the systems within the practice and across the roles and across all of the functions within the practice as well. Outside of the practice, I definitely think we're moving into an area into an era of transparency, increased transparency, as we've talked about physicians being willing to share more information, be more open with how they're treating patients and the impact that they're having by treating those patients in accordance to sound clinical guidelines.
So despite the reimbursement issues and overall economic climate, why does it remain a positive time to be in the community oncology market? Is there a silver lining we could point to?
Sure, absolutely. I think there is. A lot of the practices that we've spoken to agree, despite the challenges that we've talked about. Oncology is a area in healthcare that still is receiving an enormous amount of funding for new research. There's a lot of products in development in the pipeline. There have been really some exciting new products that have been introduced to the market recently. So I think it's a very exciting time to be in oncology, and specifically in community oncology. We feel, and our practices feel, that community oncology is the setting where we can really maximize the quality of care to the patient and also can recognize some cost efficiency through the practice of oncology in the community setting.
Matt, this has been invaluable insight. Thank you so much for being here to share your perspective on what is happening at the practice level in oncology.
Thank you for having me. It's been great to be here.
And thank you for joining us. We'll be back soon with an all-new webisode. Until then, if it's on your mind, it's in the know.